If you know you have peptic ulcer disease or you know someone that has peptic ulcer disease, please watch this video. A lot of people are in and out of the pharmacy every week to buy antacids, but this antacid will not help you say goodbye to ulcer. Peptic ulcer disease is basically a sore or more like a wound that is located at either the lining of the stomach or the upper part of your small intestine. And I'm sure you may be wondering what causes this ulcer. There are two major things that causes peptic ulcer disease. The first thing is a microorganism called Helicobacter pylori, H. pylori for short. And the second thing is a prolonged use of NSAIDs. NSAID stands for non-steroidal anti-inflammatory drugs. They are mostly pain relievers like aceclofenac, diclofenac, ibuprofen, and many others. So when you use it for a prolonged time, it can also lead to peptic ulcer disease. If your healthcare provider suspects that you have ulcer, usually you'll be sent to do a test. I will check to see if you have that microorganism, Helicobacter pylori. If you have it, you're going to be treated with some antibiotics, with some H2 receptor blockers like cimetidine or ranitidine and many others, depending on which one your health provider chooses, or some proton pump inhibitors like omeprazole, esomeprazole, and many others. The choice of medication will depend on the person and if the person has other conditions. Sometimes some bismuth-containing compounds can be added to protect the lining of the stomach. But if that test is carried out and that microorganism is not found, then an endoscopy will be carried out to check and see if you truly have that peptic ulcer disease. Then you'll also be given some medications to help protect the lining of the stomach. And you will have to drastically reduce or stop the use of NSAIDs. But generally, you have to change your lifestyle. If you smoke, you will have to stop. If you take alcohol, you will have to stop. And you will also check out to see the certain food that trigger the ulcer pain. Like for some people, it may be spicy food. For some people, it may be soda. If you notice those triggers, you have to stop it. For some people, what worsens the pain is stress or other illnesses. So whatever it is that triggers the pain, you have to try to do away with it. Antacids will not cure peptic ulcer disease. If this video was helpful to you, then please share to someone out there. Thanks for watching.